Botox is now the #1 cosmetic procedure performed in the United States, and there's a lot of good reasons for that. First of all, it's a minimally invasive procedure. You're not undergoing a major surgical procedure to get very nice results. People feel better about themselves after they've had Botox done. They look nicer, and we can treat a lot of different areas with the Botox now. We can treat the frown lines, the brow lines, crow's feet, marionette lines, and even lines on the neck. So what I'm going to do in this video is talk to you a little bit more about the Botox and see if Botox is right for you, but I think you'll find it may be. What is Botox? Well, Botox is not a filling agent like collagen. Collagen is injected under the skin to expand the skin out. Botox is actually a medicine that we inject under the skin. It acts on the end of the nerves to cause the muscles to relax. When those underlying muscles relax in the skin, the overlying wrinkles smooth out, and that's the effect that we get from Botox. How long does Botox last? Well, I like to tell my patients to expect it to last from the first injection about 3 to 6 months. Now, as you have repeat injections from the Botox, I think you will find, first of all, it does not lose its effectiveness, and secondly, I think you will get a longer lasting result. So you can expect about 6 to 12 months after you've had repeat injections. Fortunately, there are very few contraindications for Botox. The general population at large can use Botox very, very safely. We don't do Botox in pregnant women, and we also don't do Botox in some people that have neuromuscular diseases. Now, you would have to discuss with me if you have a neuromuscular disease before the Botox, and then we'll decide if Botox is right for you. With any type of procedure, there's always some risk and side effects. Fortunately, with Botox, these are very, very minimal, and that's one of the reasons it's so popular. The one thing that I always like to make people aware of is we are injecting a medicine into the skin that relaxes muscles, and this medicine does tend to migrate. Sometimes we can't control that migration, and it may migrate into a muscle that we're not expecting or wanting to relax. If that happens, you could possibly get a little droopy eyelid, or some muscle may not work quite as well as we want it to for a few months. But the medicine does wear off, and that's one of the beauties of Botox. So even if we do get that migration, it is reversible. And again, it is generally in a very small percentage of patients, only about 1%. So the safety profile is very good as far as that goes. Now, as far as direct side effects right after the procedure, there is always a chance for a little bit of bruising. We are sticking a very, very fine needle into your skin, and you can always get some bruising after an injection, and this is a little bit unpredictable, but we do everything we can to prevent the bruising. I do all the injections myself. We do not have parapersonnel do the injections, and I'm usually pretty good at avoiding bruising. But even so, there may be occasion where we will get some bruising. You may also get a transient headache or a little bit of numbness at the sites after the injections, and again, we can't predict this from individual to individual. But the overall picture of Botox is this. It has an excellent safety profile. The side effects in large are very minimal and usually reversible. And this is why it's such a popular cosmetic procedure. What are the preparations you need to do before having Botox done? Well, not a lot, actually. We can do it pretty much on any office visit, and if you're watching this video, we can pretty much do it right now if I'm available. There are a couple things that I like for people to be aware of. If they are on a blood-thinning agent like aspirin, ibuprofen, or a prescription medicine like Coumadin, let us know. Let's talk about it. That may increase your risk for bruising a little bit, but we can usually work around that. What I'm going to do right now is take you back into one of our operating rooms and just show you how we do the Botox here in my office. Now, I want you to go on and relax. It's kind of important that you relax as I do the injection, because that will be a little less uncomfortable for you when it goes in if you're relaxed. There you go. That's good. And we're going to put in about, okay, there we go. Now I'm just going to put a little loud pressure. It got a little bead of blood there. That's not unusual. And again, we're again here and do. Okay, now we're just going to shift here just a little bit. Move our needle, get to the little top part of that corrugator. And all done. Very good.
Very good. Very good.
How'd it feel?
A little stingy, but fine.
Okay, great. Very good.
No problem.
Post-Botox, what do you need to do? Well, there's not a lot of requirements. Number one, you need to maintain a vertical position for the next 3 to 4 hours. And number two is I don't want you manipulating the area. If you manipulate the area, you may get migration of the medicine into muscles that I don't want it to go into. Now, I will want you to contract the muscles that we're going to try to relax many, many times over the rest of the day. So if you've had the glabellar area done, I'm going to want you to frown like this a lot during the day. So those are the follow-ups for the Botox. It's very simple and very easy to do. Well, you've just seen a lot on Botox. I hope you're as excited about having Botox done as I'm excited about doing Botox. Botox makes a big difference in a lot of people's lives. They feel great about themselves having it done, and I think you will too. If you want to find more information about Botox, please go to my website, orlandoskindoc.com. You'll find information on Botox, plus a lot of other cosmetic procedures that we do here in my office, laser facial rejuvenation, laser hair removal. We also offer a complete product line on the website. A lot of these are skincare products that you can only get through physician's office. I don't push a lot of products here at the office. I don't want you to feel like you're getting a sales job in the office, but feel free to order off the website if you find products that you like. If you have questions or would like to schedule in for Botox, give our office a call, 407-352-2444. We'd be happy to hear from you.